Welcome to the Listen for Life Aphasia podcast. Today we are talking about swallowing disorders. You might hear it called dysphagia or dysphagia, but we're talking about it today because often dysphagia accompanies a stroke. And even if it's just transient, meaning it's there just temporarily, it's still a very important condition to understand. And how I wanted to introduce it to you today is by talking about a therapeutic method called MDTP, McNeil Dysphagia Treatment Protocol. And this was something I was trained in back in the day when I was working in home care. It was something I sought out on my own, and I loved how effective it was. So my guest today is Mary Kate O'Connell. She is a speech pathologist here in Austin, and how I came to meet her was I got on the MDTP website to find out who in my area was certified, and she was at the top of the list, and I invited her on, and I hope you get new understanding out of this episode. Welcome, Mary Kate.
Welcome to the Listen for Life podcast with Genevieve Richardson. Genevieve is a speech-language pathologist rehabilitating adults with communication challenges after a stroke or due to a neurological impairment. Get equipped with knowledge from experts in the field and professionals you need to know. We'll hear stories and experiences from others who are navigating life with aphasia. So, put your earphones in and take a walk outside. This isn't just a podcast. This is a community, a resource, and a support system. We're in this together. Do life.
Welcome, Mary Kate. Thank you so much for joining me today.
Thank you for having me. I'm so excited to be a guest speaker.
Nice. Well, you get to be on the maiden voyage of us talking about swallowing.
Yay!
So a little background is I came across your name because I logged on to the McNeil Dysphagia Treatment Program website and looked to see who was certified in Austin, Texas, and you were at the top of the list.
Amazing.
There it is.
I'm glad you found me.
Me too. So let's jump right in. Tell us a little bit about your background in speech pathology, where you work, and the kind of clients you're serving right now.
Absolutely. My journey with speech language pathology actually started long before I went to college. I have a couple of family members near and dear to my heart that actually had strokes, and they required speech therapy to recover from those strokes. And speech therapy looked a little bit different for each person, but it did include swallowing therapy, cognitive training. And so that's kind of got my wheels turning about speech therapy and initially made me interested in that. And so then fast forward a couple more years and I was off to college, and I went to the University of Alabama in Tuscaloosa, and I got my bachelor's degree in communicative disorders. And so I really was loving all of my classes, and I definitely knew that speech language pathology was what I wanted to pursue and make a career out of. Fast forward 4 more years, and I was accepted to the University of Texas at Austin, and that is where I decided to go for my master's degree. So I spent 2 years there, and I got my master's in science in speech, language, and hearing sciences, and I graduated in May of 2022. And all of that being said, due to the family history I have with strokes, I knew from the beginning that I really wanted to work with that type of population once I became a licensed speech language pathologist. So I expressed to my professors and our coordinator who helped us schedule our clinical placements. I talked to her and other professors about my interests, and I got very lucky, and I was able to really pursue that during my graduate school experience. So I had a couple of different placements around Austin that really helped shape me into the clinician that I am today and help prepare me to be able to handle and work with these different populations. And so I feel very grateful that I was able to start that journey early on in graduate school.
Neat.
Yeah. So now, fast forward another couple of years, I am a fully licensed speech language pathologist, and I work currently at an inpatient rehab hospital here in Austin.
Neat. So let's talk a little bit about swallowing. So you're in inpatient rehab. I would call it acute rehab. That was my first job out of school too. I knew that that's what I wanted to do. And so that was my first job in the beautiful city of Santa Barbara, California. And
Hey.
yes, I people were envious that I got that placement. But that I knew early that that's where I wanted to be. So, a huge part of the population I served, almost everybody had some sort of swallowing impairment. Can you talk a little bit about how often that happens, just in general, with the population you're working with?
Yeah, absolutely. I would say that probably anywhere between 50 to 75% of the people that I see every day have some type of a swallowing impairment. And some of that is really mild, but some of it can also be really, really severe where they're not able to eat anything at all. And so I would say probably about 50% or more of my day is addressing swallowing rehabilitation.
Wow. Okay, so this is not a topic I've covered yet with my audience. So let's kind of break down what is swallowing, what is, and how does it get impaired? What are some of the things you're seeing with your clients?
Absolutely. When we talk about swallowing in the world of speech language pathology, we talk about eating food, chewing food, and then swallowing food. And oftentimes, when somebody has had some type of a brain injury, whether it's a stroke, traumatic brain injury, they can have something called dysphagia. And dysphagia is a swallowing impairment. We can see dysphagia in several different forms. Some people have oral phase dysphagia, so they're having a hard time really chewing their foods up enough so that they can safely swallow it. Sometimes there's facial weakness involved that contributes to food pocketing or getting stuck. They're not able to fully clear it out of their mouths.
Mm.
We have something called pharyngeal phase dysphagia, where we have our muscles that we use for swallowing our food that can also be impaired. They can become weak after brain damage. And so that could lead to the risk of choking on foods, coughing on foods, or even having food get down into our lungs and that can make us really sick. That's called aspiration pneumonia. So in speech therapy, we're working to prevent those types of accidents from happening so that we can prevent that aspiration pneumonia and also improve quality of life. So that's a big goal of speech therapy when we work with rehabilitating a swallow, is keeping our patients safe and giving them improved quality of life.
When I was trained in swallowing, it was an interim course, meaning it was a 4-week course between Christmas break and the start of a spring semester. We had 6 weeks off, 4 weeks of it, I was in a course. And at the time, Jerry Logeman was a huge researcher in swallowing. And actually, as a condition of my first job, I had to attend in person one of her courses and report back to the department. She was the queen of what's called a modified barium swallow study. It's a video x-ray, as like a layman's kind of term for it. And she just hammered us for 3 days, one video after another. And it really became very clear where someone might be breaking down. Anyway, back in the day, treatment consisted of thickening liquids, changing the consistency of the food, head positioning. We had the supraglottic swallow, we had the chin tuck, we had those kinds of things. We didn't have a whole lot 30 years ago, but now we do. Can you tell us a little bit about the treatments available for swallowing?
Yeah, absolutely. When it comes to treatment, there are different options that you learn about in graduate school and also on the job as you're going. There's a couple of different types. There's compensatory training and treatment for dysphagia. there's also rehabilitation. So compensatory techniques would be things like a chin tuck or turning your head to the right or to the left to open up the space to allow you to swallow better. And those are meant to be short-term maneuvers or compensatory techniques that give some temporary relief or safety when somebody is at their weakest point with their swallowing. I think a lot of times these types of approaches become something that is a little, I think sometimes these approaches become kind of a crutch and they're used a little too permanently for some patients. And so they're giving them that temporary relief, but it's not truly fixing anything. And so that's when you really want to start trying to focus your efforts on the rehabilitative side of dysphagia and working to make those muscles stronger so that they can tolerate their swallow, their food, their drinks without having to chin tuck for the rest of their life or turn their head to the left or to the right forever. So if you're not working on rehabilitating those muscles, it's really hard to get rid of those compensatory techniques. So then when we come to the rehabilitative side of dysphagia treatment, there are a couple of really good go-tos. There's something called an effortful swallow. So everyone loves the effortful swallow, and the effortful swallow is helpful. It works on really using all of your might to get that food or that drink down and swallow really hard. That's essentially the principle of an effortful swallow. I've always been a really big fan of trials that will help strengthen up the musculature with whatever they might be having some trouble with. So ice trips are always a really good way to help strengthen up those muscles. That's something that we do a lot of too, is working on as many repetitions as we possibly can. That's kind of the extent of some of swallowing rehabilitation that you learn about. And so for me, when I started working in this role, I felt as though I was a little bit limited with my treatment, and I felt like I needed a little bit of extra help to provide better treatment for my patients. And that's when I found this course. It's called the McNeil Dysphagia Treatment Program.
Let's kind of unpack a little bit about McNeil Dysphagia Treatment Program. I, like you, was looking for another way to treat swallowing because being in the aphasia space or in the traumatic brain injury space, working on language and cognition, that takes time.
Yeah.
And quality of life is a huge issue. So let's just paint a picture for a second about what would it look like if you had to thicken your orange juice to a nectar consistency or a honey thick consistency. I know it's got new names now, but let's go with the old terms because not everybody's converted over to all the new nomenclature. What do you think quality of life like would be to drink thickened orange juice?
Yeah, absolutely. I think I've heard a lot of my patients tell me that the consistency of a thickened liquid just doesn't feel good when you're drinking it and swallowing it. And so I think that it starts to form a distaste for some of those things that they used to really enjoy doing. And I could imagine for myself having to adjust to this new texture, this thickened liquid would be really difficult. I think another thing that impacts quality of life is you have to take the time and do these adjustments and do these modifications. And I think that for me, I would feel as though it would take away from what I'm doing in my day to day when I'm out to lunch with a friend and I have to say, "Oh, let me thicken my orange juice,"
Let me do.
I think that's really hard for a lot of our patients, is having to adjust to using these modifications in front of not just family and friends, but also just society too. And the questions that come with it, I'm sure, are challenging.
So why would we even use thickened liquids? What's the rationale behind that?
The idea behind thickened liquids is that if something has a thicker consistency, it gives a little bit more control to the patient. There's less chance of liquid going down into their trachea versus their esophagus. And so the idea is these thickened liquids will be slowed down a little bit and give the patient more control. And the hope is less risk of aspiration.
So you were looking for another way. How
Yeah.
did you even come across McNeil Dysphagia Treatment Program?
Yeah, absolutely. I have heard of McNeil through a lot of different people. I've heard it from past supervisors, colleagues. I'm also a member of an online forum on Facebook where medical SLPs can get together and talk about interventions and courses and things that are working, things that are not working. And I kept seeing the McNeil Dysphagia Therapy Program popping up kind of all over the place. And so that's how it really sparked my interest.
Neat. It was nearly the same for me. I was at my state convention and it might have been a 3-hour, paid course at the state convention, thinking, oh, let's just check it out. And I was blown away by the research that backed it up and really the ease of implementing it. Not only for us, which is nice, it's nice for us to have something easy to implement, but also it made so much sense to the clients, even if they had a language impairment, even if they had a cognitive impairment, like they couldn't maybe pay attention or follow directions as well. We now had a tool and a protocol to really make a difference.
Absolutely.
So tell us a little bit about the McNeil Dysphagia Treatment Program and the idea behind it.
Absolutely. Earlier, I had mentioned in dysphagia treatment, we have compensatory techniques and we have rehabilitation of the swallow. McNeil is all about the rehabilitation of the swallow, which is a really excellent way to approach dysphagia treatment because you are working on strengthening those muscles and getting them to the point where they're able to function on their own without chin tucks and without turning to the left or the right or without thickening liquids. And it has such great success rates, tons of research behind it. The researchers and the team at McNeil have put so much time and effort into creating this wonderful protocol that I completely agree with what you said. It is easy to use and easy to follow. And it really does allow you to work on the main goal of strengthening those muscles and fixing them and getting them to the point where our patients can have what they want to eat without having to be scared of choking or aspirating. And I think that's a wonderful, wonderful thing. I think another excellent part about McNeil is that it really works on, again, rehabilitation of the swallow, but it teaches you the exercise principles behind the swallow, which is something that our other disciplines of physical therapy, occupational therapy, they spend a lot of time in school learning exercise physiology and things like that. But unfortunately, that is not really something that speech language pathologists get much training on in graduate school. I know you mentioned sometimes dysphagia is a 4-week course and sometimes it's longer, but in that time span, the exercise physiology that you need to know in order to really understand the whole swallowing mechanism is not something that is really talked about. And so I was really in awe of what I learned in the McNeil program about exercise physiology and how I can use that as an advantage to myself and to my patients when implementing that in therapy. Really understanding the why and the how behind the physiology of swallowing.
Right. What I remember of the protocol is you start at the level of consistency that they are safe with, and it's getting them to swallow again and again and again and again and then maybe a brief break and then more swallowing. It's because the best as the instructors taught me, the best treatment for swallowing is swallowing.
Absolutely. I love that phrase. And I think it is so true, right? The best way to work on your swallowing is to swallow. And McNeil definitely backs that up.
Definitely. So my whole reason wanting you to come on and share more about this is so that this community, whether it's them or their person that they know may have swallowing problems, but they likely know somebody else in the stroke, traumatic brain injury community that needs to know this information. They need to know that this is a viable, evidence based treatment method that can really improve somebody's quality of life, not drinking thick orange juice.
Yes.
And that these families need to know about it so that they can seek it out. Maybe they're at a facility that doesn't have anybody there, but they could ask for it. They could ask for it. They could get on the website, McNeil Dysphagia Treatment Therapy, and find a clinician that works in that to get the help that they need.
Absolutely.
Yeah, it's all about empowerment. That's the whole reason behind this podcast and providing as much information as we can. Let's just touch on one other risk we didn't talk about besides aspiration pneumonia. If someone is on thickened liquids, what else could they be at risk for if they're not drinking enough?
Dehydration and malnutrition. A lot of patients do not prefer thickened liquids, and when that's their only option, they stop drinking as much and they don't drink water in their rooms. They do not have the juice, at breakfast. And so they just stop drinking and they really are at risk for dehydration and not having enough energy, enough water to get them through their days. And if you're somebody who has had a stroke or a brain injury or anything else that's requiring a lot of rehabilitation, you need your strength and you need your energy to be able to participate in therapy and your daily life to get better.
Absolutely. The other thing I used to see often, especially with some of the older clients, if they were getting dehydrated, they got confused.
Yes, yes, that can lead to UTIs and general confusion. It can cause a lot of snowballed effect, negative implications, and it all can start from thickening liquids.
Yeah.
For
So there is a place for it and a time for it, but there's also rehabilitation that can get people away from it.
yes.
Hopefully a lot quicker than we used to do a long time ago. But I really loved how you talked about the compensatory strategies versus the rehabilitation. Both are necessary. Compensatory, immediate, fix, not fix because nothing's perfect. We still have other considerations. How they're sitting up, if they're eating in bed, drinking in bed, are they sitting all the way up? Are they going to take those extra 7-8 seconds to get their hospital bed all the way up? Or are they going to be laying down drinking? There's other considerations for swallowing that we can't really get into today, but the idea is if you're visiting someone in the hospital and there's a sign above their bed that says, you should actually tell us what you guys do at your facility. We used to have signs above the bed that said thickened liquids only, sit all the way upright, ask the nurse first, these kinds of signage. Why are these important for visitors to be aware of and to pay attention to?
Yeah, excellent question. And at my facility, we do use signs above the bed that we outline their diet for their food textures. We outline their liquid consistencies and any strategies that are helpful for them or recommendations like getting out of bed or sitting upright,
Mhm.
eating slowly. We do highlight those things and we use wristbands and whiteboards and we make it nice and clear for anybody who walks in what is their diet, what are their strategies, what are their liquids, so that anybody who interacts with them, whether it's a family member, a friend, or a staff member, can make sure that they're doing what's best to keep that patient safe. Because everybody is going to have different needs when it comes to their swallowing impairments, and how they can stay safe is by following the strategies that a speech language pathologist has outlined for them. And so it's very important that, especially family and visitors who are not at the hospital all day, they know what's going on. So if they decide they want to bring their loved one a piece of cake for dessert, but oh, they can't have cake right now. They might not know that, but if we put signage, they can see that and they can save their loved one from maybe having an incident where they're having some trouble with their food.
Yeah. And aspiration does not always show with a throat clear, a cough. What is the other kind of aspiration, Mary Kate?
Ooh, we also have silent aspiration, which is scary. That can occur when a patient, maybe if they're having weakness or they're having poor sensation, they might be aspirating on their liquids or their foods and their body is not able to detect it. So there are no visible or audible signs that something is going wrong.
Let's do it for instance. Let's say I'm visiting my person in the hospital and I'm not me. I'm not me. I don't know what I know about swallowing. And I noticed a sign and they're kind of maybe slumped over in their bed and they're like, water, I'm thirsty. But yet there's this sign that talks about swallowing. What should I do as the visitor? Because of course my friend is here or my loved one is here in the bed and they're asking for water and I want to be compassionate and give it to them. What would you want me to do in that situation?
Thank you for asking that. That is a wonderful question and something that I think absolutely should be talked about. In that instance, I would absolutely recommend the family member or the friend to read over the sign and look at what's being outlined and then follow up with a staff member who knows the patient better and talk to maybe the nurse. Hey, I saw that my best friend is on a thickened liquid. What is that? Can you show me how to make a thickened liquid? She's really thirsty and I'd love to help her. Can you teach me how to do this? And hopefully the nurse would follow up with the speech therapist the next day and say, hi, their friend was asking what all of this means. Would you mind giving them a call and talking through what this means so that they can better understand what's happening with their friend and why it's important that we follow these procedures to keep their friend safe?
Absolutely. Well, this has been a great conversation. It's fun for me to talk about the swallowing. Like I said, it was one of my favorite areas to work with clients. I'm really excited to have met you and hear what you're doing regarding swallowing and using this treatment method to improve the quality of life of your clients.
Thank you. And thank you so much for having me. This was really fun for me too to get to talk with you and share my love for this population and how we can best help them and keep them safe.
Wonderful. Thank you so much, Mary Kate. Have a great day.
Every day.
Thanks for tuning in to the Listen for Life podcast. We hope you feel empowered and supported. Head over to listenforlifepodcast.com to see the show notes with links and information from today's episode. Do you have a topic, a resource to share, or a guest recommendation? Inquiring minds want to know. Let us know in the comments section. Wishing you a fabulous week.